Hey guys, happy Tuesday. It's Dr. Lisa coming to you live from Tampa, Florida for another one of my daily updates and connections with you during this COVID-19 insanity. So I hope you're hanging in there. I know we are here at our clinic, Spectra Wellness in Tampa, and we are still seeing patients both via telemedicine and in person. We have very strict guidelines to who and how we're having patients come in the clinic, and we are thrilled to be able to still provide high-level medical care, IV vitamin C therapies, and everything else that we do here to keep you safe, healthy, and in your highest version of you. So if you can, make sure you connect, because what I wanted to talk about today are some super interesting statistics that are coming out, and these are not, published. Some of what I like to bring up in these conversations we're having are just things that I find interesting. And what I have found incredibly interesting is that a lot of the hospitals now around the country are empty. So I think you probably did not think I would say that, but they are. Our local hospital major trauma center is, very low in terms of their census right now, which is potentially a really good thing, considering we really have this unknown about the peak of the virus and the number of people that are going to need to have care. And a lot of the elective procedures have been canceled, so that's where some of the emptiness is coming from, and that makes sense. It does make me wonder, after all of this, where, how are we going to handle everybody's knee that's been hurting and was supposed to be replaced, those types of things. But the really interesting editorial I read out of the it was the New York Times, was the fact that the cardiologists are reporting that heart attacks, which, seem to be uncontrollable, and we know the risk factors, and Lord knows they're at a peak right now, are down with a very high percentage number. So why is it that, cardiologists are not seeing the same number? Because it's around 50% from, these reports that are coming in. Why would that be, that we're down half, when we think of triggers for cardiovascular events being stress, and we're all at maybe the highest level of stress we've seen in some time, eating junk, and a lot of people are eating poorly. So, the explanation for that one is unclear. Could it be that people are not as stressed in terms of their day-to-day work environment? Maybe they're not pushing it at the gym like they were. These are a few things that people are trying to come up with, or concepts, but I do find it very, very interesting. And the concern that I have, and that some others have, is that could it be people are having symptoms and they're just scared to contact their physicians, or to, understandably scared to go to the ER. So what I wanted to talk about in regards to that today is just making sure you know that during this time there are still medical providers. We're here, whether it's telemedicine or whether it's in person, to help you navigate. If you're having issues with abdominal pain, or your blood sugar, or your blood pressure, don't feel nervous about overwhelming the medical system. I think a lot of people are actually more available than they were, which is an interesting counterintuitive outcome of this at this stage. So pay attention, and a really neat tool that I share with my patients that I want you to try is each morning when you wake up, if you can start a scan. So it's almost like you're going to be scanning yourself in a CAT scanner, but you're going to do it with your own body, and just start at your toes and tune in from the bottom and move all the way up, toes to your foot, to your ankle, kind of in those types of stages. And each time just check in and make sure everything feels okay, and then give your body some gratitude. Just thank it for providing you with the amazing service that it does day in and day out. for stabilizing you when you stand up and allowing you to run. As you move up, you can come up with different things. Make sure you tap in to your different organs. Go up into your sexual organs, into your colon, things you probably maybe have never thought about giving some attention to or gratitude to. This whole scan is something I actually try to do at least several times a week. I would love for you guys to get into the pattern of doing it now. Because giving gratitude and connecting is a form of self-love, but it's also a way to stay on top of your own health. And again, in this time and with what's going on, we need every part of us to be working at top capacity. So keep scanning all the way up, and each time you feel something, kind of navigate it, journal if you need to, reach out to a healthcare professional if you need to, and most importantly, give it back gratitude. Make sure that if you guys are going to be in a public place with people that you have not been around, that you wear some type of mask. That is strongly recommended at this point. Enough studies have come out saying that we don't understand how this is being passed, and that simple conversations may be a potential way. So we're going to be stepping up a little bit more of our diligence with mask wearing. We talked briefly about that yesterday. So that was about all I wanted to share today. Some interesting thoughts on the healthcare system, on an editorial I read that was entitled "Where Have All the Heart Attacks Gone?" And we'll see. It will be very interesting to watch how that all unplays and how it plays out over, and how it unfolds and plays out over the next few weeks. We are hopeful. We are here to serve, and I appreciate your questions, your shares. And to end with an affirmation, the affirmation for today is that I listen to my body and honor it at all times. So if you're having something going on, but you're scared, you don't want to overwhelm the healthcare system, you don't want to go to the hospital, please remember to listen to your body. I listen to my body and honor it at all times. Take care. Contact us if you need us, and I hope you all have a great day. Bye for now.